Welcome back to part 3 of Introduction to Anatomy, which is about positions of the human body. We have two positions of the human body. They are general and special. Both of these positions are varieties of the basic human positions, which are 3S, LK. The 3S are standing, sitting, squatting. LK are lying and kneeling. The general human position are not necessary to us. These are not our concern and may be applied to daily human activities such as dancing, sleeping, shooting, copulation, as seen in these figures. This figure shows the sleeping positions, shooting position, eating, meditation, dancing, and other activities. They are not our concern. What we concern about is the special positions of the human bodies, which they have a strong relation to anatomico-medical issues. They serve some medical and surgical procedures, and they are vital to us and to study. They are as follows: standard anatomical position, supine, prone, lithotomy, Trendelenburg, Decubitus, Sims, and Fowler's position. Regarding the standard anatomical position, it is taken previously and it is used to describe various body structures and regions. The second one is the supine position, which is also called the recumbent and dorsal decubitus position. Supine, I hope you remember the soup in which the face or palm directed superiorly towards the sky. Recumbent is a general term for lying down, but when this lying down on the back is called supine. So supine is a special type of recumbent position, also called dorsal decubitus, in which the dorsal aspect of the human body is in contact with the ground, as seen in this figure, supine position. Third position is the prone position, in which the body is lying down on the abdomen and face down, as seen in this figure, supine and prone position. Lithotomy position, in which the patient is lying down on the back, both hips and knees are flexed and the thighs are apart or externally rotated. This position is used for vaginal examination and childbirth, as seen in this figure. Trendelenburg position, this position is invented by German surgeon at the First World War to treat soldiers with shock. It is a special type of supine position in which the bed is inclined at varying angles, so the pelvis become higher than the head. As I said, it is used in shock and pelvic surgery. I want you to look at this picture, and I want you to look to this figure and notice the wrong title for Trendelenburg position. Yes, you are right. The reverse is true. The first from the right, the upper right figure representing the classical or original Trendelenburg position, and the other one at the left represent the reverse, because the original Trendelenburg position, the pelvis must be at higher level than the head. The uses of Trendelenburg position to decrease the oedema or bleeding at the lower limb, and also used, as I mentioned before, in shock conditions to increase blood or perfusion to the heart and head, brain or heart, or other vital organs. This is the reverse, used in head and neck surgeries. The other position is the Decubitus position. Although it could be represented by other or previous position, but this position or this term must be discussed here. Decubitus came from cubitum, which is a Latin word, came from elbow. And the Romans habitually rested on their elbow, so-called Decubitus position. This term, Decubitus, represents two situations. It is a position when a person is lying down on the bed. And also it represents a situation when this lying down is prolonged, causing ulcer or bed sore. So it is called Decubitus ulcer. Now we have variations for this position, for Decubitus position. We have dorsal Decubitus, which is also called supine, as mentioned before, ventral Decubitus, prone position, lateral Decubitus. So it is named according to which surface of the body touching the bed. For example, lateral Decubitus used in total hip arthroplasty as seen in this figure. Sims position, also called lateral recumbent, named by the gynecologist James Marion Sims. The patient lies on the left side and the left lower extremity is straightened while the right lower extremity is flexed at the hip and knee, as seen in this figure. But the wrong thing in this figure is that it lies on its right side, and as mentioned before, the Sims must be lying on its left side. So the correction for the previous picture is this one, lying on the left side, the left lower extremity is straightened and the right lower extremity is flexed. This is used for anorectal examination. Other position, Fowler's position. This position is used too much for post-operative patient to promote maximum chest expansion and good airway, good oxygenation. So it is used in respiratory distress, also after abdominal surgery to promote abdominal muscle relaxation, and in feeding post-operative, as I mentioned. The standard Fowler's position is 45 to 60 degree angle between the bed and elevated head. This is the standard Fowler's position. Also, this is the another figure, Fowler's position. Other topic for this presentation is the major differences between male and female. Grossly female body are generally more thick and fatty than male. Male is more muscular. This is due to accumulation of fat in the subcutaneous tissue of the female body or superficial fascia. Also, the distribution of fat is different due to hormonal or metabolic factor. The distribution is represented by android fat deposition, or called apple shape for the male, and gynoid fat deposition or pear shape for the female. Also, grossly, we could notice that the shoulder region of the male is wider than the pelvic region and could be represented by inverted triangle. This is on the contrary to the female. The pelvic region is wider than the shoulder region, which could be represented by normal triangle. Also, this may be misleading for the female due to the presence of breasts. The bony landmarks, which are very important, the bony landmarks of the male are more prominent. The bone of the male is more rough and more thick. This is due to the traction force of strong muscles of the male. For the female, it is thin and smooth, as you could see in this figure. The clavicle of the female is smooth and small, thin, while the clavicle of the male is large, thick, and perforated. These differences enable the archaeologists and anatomists to differentiate between the male and female. Also, these differences could be used by archaeologists to differentiate between the kings and workers of the old Egypt. Workers get more thick and rigid, rough bones. And I want you to realize that the dimensional, skeletal, or musculoskeletal differences between the male and female oblige the manufacturers to make the female bicycles with special dimensions, as you could see in this figure. This is the end of my presentation today. Thank you for your listening.